in Science Fellowship. Dr. Nibin Dus, Health Specialist, UNICEF Egypt. Dr. Ali Hussein, Professor of Curriculum of Pedagogy, Al-Azhar University. And this session will be moderated by Dr. Mutrij Bjun Bahdrunov, Health Specialist, UNICEF Egypt.
Thank you very much. Esteemed colleagues and distinguished guests, it's a pleasure to be here. And first of all, I would like to express sincere thanks to organizers, to Ministry of Health and organizers of this Congress, which provided an excellent opportunity for us to discuss different important subjects. Particularly today, this is an excellent opportunity for us to discuss an important topic that affects each of us. This is about mental health and resilience. During discussion with esteemed speakers, we will explore comprehensive perspective on this topic in the context of worldwide challenges. Our discussion also will include integrating mental health in primary healthcare services and other social services. We will also focus on the role of primary healthcare and community health workers in prevention, early detection, and intervention. Another important area, which is building resilience, and we have also good opportunity to hear from our researchers to provide us with evidence from research in promoting of mental health. We will also learn and discuss stories and lessons learned from global, regional, and country perspective. With great pleasure, I would like to start giving speech to our esteemed speakers. And floor is now with Dr. Ali Hussein, Professor of Curriculum and Pedagogy of Al-Azhar University. So each of presenters will have a 10 minutes presentation. Then after all presentation, we will have a discussion and question and discussion. Dr. Ali, please, floor is yours.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أهلا وسهلا بحضراتكم في هذا الملتقى العلمي الرائع والمتميز. أهلا بكم جميعا. أنا سعيد أولا أن أنا في هذا الملتقى أتشرف بحضوركم وأتشرف بهذا المكان، ونتمنى أن يرزقنا الله في هذا المكان وغيره الأمن والأمان والسلام المستدام. أهلا وسهلا بحضراتكم. الحضور الكريم، قديما قالوا أن رحلة 1000 ميل تبدأ بخطوة، ولكن في أي اتجاه. لحظة تأمل مع النفس. إذن أين نحن؟ ولماذا نحن هنا؟ وكيف وماذا بعد؟ نحن في لقاء علمي متميز يجمع بين العلم والعمل والرؤى المستقبلية في مجال التعلم الاجتماعي الوجداني. لماذا؟ لتعزيز الجهود المبذولة والتجارب والتجاوب مع التوجه العالمي نحو توكيد الصحة العقلية والصحة النفسية في سياق التحديات العالمية المعاصرة. كيف؟ من خلال عرض ومناقشة الجهود والتجارب الرائدة في مجال التعلم الوجداني الاجتماعي، واقتراح بعض الأفكار الجديدة لتطوير هذا المجال المهم. ماذا بعد هذا الملتقى؟ ماذا يحدث أو ماذا نرجو؟ نرجو التعاون معا لتوفير سياق تربوي صحي وآمن نفسيا يساعد في بناء شخصية المتعلم بشكل متوازن ومتكامل معرفيا ووجدانيا ومهاريا، وبما يمكنه من الصمود في ضوء التحديات العالمية، وبما يمكنه أيضا من التجاوب الفعال مع مقتضيات العصر الحالي وتحدياته. نعرض هنا تجربة مكتب اليونسكو بالقاهرة في هذا المجال في إطار الجهود التربوية الجهود العلمية والتربوية التي يقوم بها مكتب اليونسكو الإقليمي للعلوم في الدول العربية في القاهرة، ومن خلال مبادرة اليونسكو في مجال المدارس المفتوحة للجميع المدعوم بالتكنولوجيا. قام المكتب بإعداد دورة رقمية تفاعلية في مجال التعلم الوجداني الاجتماعي. هذه الدورة الرقمية التفاعلية موجهة في الأساس للمعلمين ومدير المدارس والمشرفين الأكاديميين والتربويين بجمهورية مصر العربية، وذلك لتعزيز مبادئ ومهارات الصحة النفسية والعقلية لديهم، وتمكينهم من بناء علاقات صحية مع أنفسهم ومع طلابهم، وإدارة فصولهم الدراسية في إطار اجتماعي وتعليمي فعال. وبالتبعية ينتقل أثر هذا التدريب إلى المتعلمين أنفسهم بعد ذلك. في هذه الدورة قد تبنينا النموذج الهندي الخاص بمعهد غاندي للتربية من أجل السلام والتنمية المستدامة. هذا النموذج يقوم على 4 أبعاد رئيسة: التعاطف أو المشاركة الوجدانية، والتراحم، واليقظة الذهنية، ثم التفكير النقدي أو البحث النقدي. الهدف من هذه الدورة التي أعدها مكتب اليونسكو، الهدف تمثل في تنمية قدرات المعلمين ومدير المدارس والمشرفين في مجال التعلم الوجداني الاجتماعي، وإدماج تكنولوجيا المعلومات والاتصالات في الممارسات المهنية، وصناعة المحتوى الرقمي في مجال التعلم الاجتماعي والوجداني. يعني لم تكتفي هذه الدورة بمجال التعلم الاجتماعي الوجداني، بل أضافت عليه دمج التكنولوجيا في هذا المجال وتمكين المعلمين من استخدامها في تعزيز هذا المجال. ماذا تم لتحقيق هذا الهدف؟ تم إعداد وتنفيذ برنامج تدريبي لتنمية مهارات صناعة المحتوى الرقمي التعليمي وإدماج تكنولوجيا المعلومات والاتصالات في الممارسات المهنية لدى المعلمين في مجال التعلم الاجتماعي الوجداني. تم أيضا إعداد دورة تفاعلية في مجال التعلم الوجداني الاجتماعي في ضوء فلسفة التعلم البنائي ومبادئ التدريب المدمج والتعلم الذاتي عبر المسار الإلكتروني التفاعلي من خلال المصادر الإلكترونية والمواد التعليمية الرقمية، وفي ضوء تجربة معهد غاندي للتربية من أجل السلام والتنمية المستدامة في مجال التعلم الوجداني الاجتماعي. وستقدم هذه الدورة من خلال منصة أكاديمية المعلمين بجمهورية مصر العالمية، بجمهورية مصر العربية، لتنمية وتعزيز قدرات المتعلمين في مجال التعلم الوجداني والاجتماعي. الأهداف الإجرائية لهذه الدورة: رقم 1، تعزيز الممارسات التربوية والمهنية الداعمة للتعلم الوجداني الاجتماعي داخل وخارج المؤسسات التعليمية. تقدير الأهمية التربوية والحياتية لمهارات التعلم الوجداني الاجتماعي وضرورة تفعيلها في العملية التعليمية. تعزيز الثقة بالذات وبناء العلاقات الاجتماعية وإدارتها في إطار احترام حقوق الآخرين. دمج مهارات التعلم الوجداني الاجتماعي في السياقات التعليمية المختلفة، سواء كان ذلك في إطار المنهج الرسمي أو غير الرسمي. المشاركة الإيجابية في تنمية الوعي بطبيعة التعلم الاجتماعي الوجداني ومدى أهميته للفرد والمجتمع محليا وعالميا. تلك هي أهداف هذه الدورة والتي تنال منها أهميتها الكبرى. محتوى هذه الدورة التي أعدها المكتب: تضمنت الدورة 5 مديولات رقمية، هي 5 وحدات تعليمية صغيرة قائمة على التعلم الذاتي عبر المسار الإلكتروني التفاعلي، بالإضافة إلى الإطار العام للدورة والذي يتضمن التعريف بالدورة وأهدافها العامة والإجرائية واستراتيجيات التعليم والتعلم وأساليب التكوين. الإطار العام للدورة: الموديول الأول كان عبارة عن مقدمة في التعلم الوجداني الاجتماعي المديول الثاني تصميم وإدارة البيئة الصفية الداعمة للتعلم الوجداني الاجتماعي، تنمية كفاءات الوعي الذاتي والتعاطف والتراحم، تنمية كفاءات الوعي الاجتماعي واليقظة العقلية والتفكير الناقد. المديول الأخير بناء العلاقات الاجتماعية الصحية. كل مديول من هذه المديولات الخمس تضمن عنوانا محددا، نواتج التعلم المستهدفة من هذا المديول، الفيديوهات التعليمية الرقمية المتاحة والمصادر التعليمية المتاحة المفتوحة، وكذلك المادة العلمية المحتوى العلمي، ثم الأنشطة التطبيقية، ثم الممارسة الختامية، ثم ينتهي التقويم ينتهي المديول بتقييم بعدي، ثم المراجع والمصادر التي يمكن أن نرجع لها المعلم بعد ذلك. هذا هو المديول الأول. استهدف هذا المديول تنمية الوعي بطبيعة التعلم الوجداني الاجتماعي وأهميته لدى المعلمين والموجهين ومديري المؤسسات التعليمية والمشرفين الأكاديميين والاجتماعيين. المديول الثاني دار حول ده توصيف المديولات طبعا. المديول الأول دار حول تعريف التعلم الوجداني، توضيح أهميته، ضرورة تفعيله في العملية التعليمية، اقتراح بعض الآثار. هذه هي الأهداف المنشودة من هذا المديول. الموضوعات أو المحتوى الخاص بهذا المديول دار حول مفهوم التعلم الاجتماعي الوجداني، أهميته، العلاقة الإيجابية بين العاطفة والتعلم. كثيرا ما يهمل المعلمون البعد الوجداني في عملية التعليم والتعلم، رغم أن البعد الوجداني يؤثر كثيرا في الاستيعاب وفي فهم مادة التعلم وبقاء أثر هذا التعلم. فالعاطفة تمثل البيئة الحاضنة للمعلومات والمهارات والمعارف التي يتم اكتسابها في الموقف التعليمي، فبدون هذه البيئة الحاضنة سينتهي أثر التعلم. ولذلك كان هناك بعدا في هذا المديول وهو الخاص بالعلاقة الإيجابية بين العاطفة والتعلم، كذلك متطلبات تفعيل التعلم الاجتماعي الوجداني في المؤسسات التعليمية. كما قلت هذه المديولات موجهة للمعلمين في المقام الأول حتى يدركوا هذا. المديول رقم 2 تصميم وإدارة البيئة الصفية الداعمة للتعلم الاجتماعي الوجداني. في هذا المديول استهدفنا تحديد أن المعلم بعد ما يأخذ هذا المديول أو بعد ما يقوم بدراسته يكون قادرا على تحديد أهمية بناء مساحات تعلم آمنة نفسيا ووجدانيا لتمكين التعلم الاجتماعي الوجداني، تحديد خصائص البيئة الصفية التي تدعم التعلم الاجتماعي الوجداني، استنتاج المعايير التربوية الواجب توفرها في البيئة الصفية التي تعزز التعلم الاجتماعي والعاطفي، اكتساب مهارات التخطيط والتعليم الجيد لإنشاء فصول دراسية مدارة بشكل جيد وتعزز التعلم الاجتماعي الوجداني، اكتساب مهارات تصميم وإدارة البيئة الصفية الآمنة جسديا ونفسيا واجتماعيا وتحفز ممارسة التعلم الوجداني الاجتماعي. تمام كده. أنقل سريعا حتى الوقت المحدود، يعني سريعا تعرضنا كمحتوى لمفهوم البيئة الصفية، أسس وقواعد التفاعل الصفي الإيجابي والداعم للتعلم العاطفي والاجتماعي، معايير إدارة هذه البيئة، تصميم وإدارة البيئة بشكل جيد، البيئة التعليمية هنا أقصد. المديول الثالث تطوير كفاءات التعاطف والرحمة، تحديد إطار العمل EMC2 الخاص بنموذج بمعهد غاندي، تحديد مفهوم التعاطف، بناء التعاطف مع الطلاب، تعزيز التعاطف بين المعلم والطالب، تطوير تقنيات التعاطف مع الذات، مفهوم الرحمة وأهميتها التربوية، دور الرحمة في حياتنا اليومية، تعلم أدوات لتنمية التعاطف مع الذات. وكما قلت هذا البعد يكاد يكون غائبا في عملية التعليم والتعلم. من المهم جدا أن يعزز التعليم بناء الثقة بالذات وتطوير الذات وبناء العلاقات الاجتماعية، ولا نقتصر أبدا على المعارف والمهارات. المعارف والمهارات مهمة جدا، ولكن قد يسبقها البيئة التي تنمو فيها هذه المعارف وتلك المهارات، وهي البيئة الاجتماعية والوجدانية. كم هو مهم الأمن النفسي للمتعلم. المديول الرابع تطوير كفاءات اليقظة العقلية والتفكير النقدي. تناولنا أو استهدفنا تحديد الإطار المفاهيم الخاص باليقظة العقلية، توضيح مفهوم اليقظة العقلية وأهميتها، تقدير الأهمية التربوية للوعي الاجتماعي. اليقظة العقلية هنا أن يكون المتعلم واعيا لنفسه، أو يكون المعلم حتى ذاته واعيا لنفسه، وواعي بخياله، هل هو في الاتجاه الصحيح أم في الاتجاه الخاطئ، في الاتجاه السلبي أم في الاتجاه الإيجابي، هل يثق في نفسه أم لا؟ فاليقظة العقلية ضرورة. أيضا اكتساب المهارات والسلوكيات وأدوات بناء اليقظة العقلية بين الطلاب والمعلمين، توضيح مفهوم اليقظة والاستقصاء النقدي لها في الحياة وفي الفصول الدراسية، توضيح مفهوم الاستفسار النقدي، كيف يستفسر بشكل نقدي، وأهمية هذا الاستفسار في عملية التعليم والتعليم. الموديول الخامس والأخير دار هذا الموديول حول بناء وإدارة علاقات اجتماعية صحية، وكم هي مهمة أيضا أن تكون هناك علاقات اجتماعية صحية بين المتعلمين أنفسهم وبين المعلمين وبين المعلمين والمتعلمين، ولن يتم ذلك إلا بالوعي التام ومعرفة المقصود بهذه البيئة ومهارات بناء هذه البيئة والمحافظة عليها. في هذا المديول استهدفنا بعد دراسة هذا المديول أن يكون المعلم ومدير المدرسة والمرشد الاجتماعي على وعي تام بفهم طبيعة المجتمع البشري والتنوع الثقافي والاجتماعي وأهميته في الحياة. مهم جدا لنا كتربويين أو للتربويين بشكل عام والمعلمين أن يدركوا أهمية التنوع الثقافي. لن يحترموا حقوق الغير بدون الوعي بالتنوع الثقافي، وأن لكل مجتمع خصوصيته ولكل مجتمع هويته التي يجب أن تصان في عملية التعليم والتعليم وفي الحياة اليومية بعد ذلك. وصف العلاقات الصحية وتحديد خصائص العلاقات الصحية، القدرة على تصميم بيئات تعليمية وأنشطة داعمة لتنمية مهارات بناء علاقات صحية، اكتساب مهارات بناء العلاقات الصحية داخل المؤسسات التعليمية، القدرة على تصميم بيئات تعليمية وأنشطة داعمة لتنمية بناء العلاقات الاجتماعية الصحية، ممارسة الاحترام المتبادل في ضوء التنوع الثقافي والاجتماعي. الموضوعات التي تم تناولها في هذا المديول: طبيعة المجتمع البشري، تحديد العلاقات وخصائصها، بناء وإدارة العلاقات الصحية، دور المعلم في تنمية العلاقات، في تنمية المهارات الاجتماعية، الأنشطة التعليمية وكيفية توظيفها لتعزيز بناء وإدارة العلاقات الاجتماعية، مفهوم التنوع الثقافي والعقائدي وأهميته في الحياة، دور الفرد في المجتمع، طرق تدريب الطلاب على التنوع والاعتماد المتبادل بين الأجناس المختلفة. وختاما، من خلال هذا المديول وهذه الوحدة وغيرها، أو من خلال هذه الدورة وغيرها، نأمل أن تسهم هذه الدورة التفاعلية المهمة وغيرها من الجهود المبذولة في تنمية قدرات المعلمين والمعلمات ومديري المدارس والمشرفين الأكاديميين والتربويين في مجال التعلم الوجداني الاجتماعي. فهدفنا هو تعزيز مبادئ ومهارات الصحة النفسية والعقلية لديهم، وتمكينهم من بناء علاقات صحية مع أنفسهم ومع طلابهم داخل وخارج المؤسسات التعليمية، ومن ثم التوطين لثقافة الصحة النفسية والأمن النفسي والتعايش الإيجابي والتعلم الفعال. شكرا جزيلا، والسلام عليكم ورحمة الله وبركاته. شكرا. Thank you very much.
Thank you very much, Professor Ali Hussein. I mean, this is really incredible work. Professor, you mentioned about one important element about, in many cases, teachers are neglecting children's emotional state, which is critically important on educational achievement of children. And this is an excellent work which bringing global experience from India and also introducing new technology, digital transformation, integrating digital health, digital technology in promoting mental health. And this is an excellent opportunity, and I think this will have a great impact in children's state and also future human development, which is relevant to this course. I would like to invite our next speaker, Dr. Mai Gamal, sorry, lecturer at the Computer Science and Engineering Program, German University in Cairo, and recipient of El L'Oreal UNESCO for Women and Science Fellowship. Dr. Mai, please, you have 10 minutes. Thank you very much.
السلام عليكم. شكرا جميعا لحضوركم. Hi everyone, thank you for your presence today. أنا بس حابة أوضح حاجة قبل ما أبدأ. المادة العلمية اللي أنا هاعرضها هي في الأساس باللغة الإنجليزية، ولكن نتيجة تباين الحضور ما بين مصريين وغير مصريين، فأنا هاحاول إن أنا أدمج اللغة العربية باللغة الإنجليزية في الشرح، وأتمنى إن أنا أوصل لجميع الحضور. طيب أنا النهارده هاتكلم عن ما نسميه a transdisciplinary approach for better understanding of depression. فأنا هاتكلم في الأصل عن مرض الاكتئاب. خلوني الأول نتعرف على بعض الناس المشهورين قد بعضنا نعرفهم. الأول هو الممثل المعروف روبن ويليامز، واللي توفى في عام 2014. ولاعب كورة ألماني معروف روبرت أنيكا وتوفى في 2009. وميوزيشن معروف كريس كورنيل وتوفى في 2017. فالتلاتة دول هم they are from different backgrounds, different fields، ولكن في حاجة من بينهم هم التلاتة، وهم إن التلاتة ماتوا بالانتحار نتيجة مرض الاكتئاب. على الرغم من نجاحهم، على الرغم من شهرتهم، على الرغم من سعادتهم اللي الناس قد تكون شايفاها من برّه، ولكن النتيجة إن هم ماتوا بالانتحار. وخلّوني أقول كلمة من قالها كريس كورنيل، هو قال: "I went through a serious crisis with depression where I didn't eat a whole meat every day. I know what it feels like to be suicidal, and I know what it feels like to be hopeless." Okay. So for the translation team that are helping us with the translation, let me complete the presentation completely in English. So this is what Chris Cornell, he said, how it feels to be hopeless. And he said this like before committing suicide. And despite of that, he committed suicide. So let's know first, what is depression? So depression, or its clinical term, it's a major depressive disorder, or MDD. Depression is diagnosed when a person has persistently low or depressed mood, decreased interest in pleasurable activities, feelings of guilt, appetite changes, sleep disturbance, or suicidal thoughts. These are some of the symptoms that a depressed person may have. Every depressed person may have some of them, and two of them, three of them, and it really depends based on the person. So this is like the clinical definition of major depressive disorder or depression. Now let's know how it feels like to live with depression. So depression, it has really serious complications, both on the physical health and the disabilities sides. For the physical health, depression is known to be associated with cancer, Alzheimer's, diabetes, and hypertension. So it really has strong connection with physical health issues. And for the disabilities, it's known to cause functional impairment. So a person who has depression usually faces issues in continuing in his life in terms of his work and his normal life. And social impairment, he has issues in sustaining his relationships and forming them in a good way. And generally low quality of life, daily quality of life, and self-destructive behavior. So we can see that complications of depression are not just on the psychological side, but it's also on the physical side. And depression is known to be a leading cause of disability worldwide. And it doesn't only affect the person who has depression, it also affects his family and the whole community. And it's known that depression has significant economic implications for the whole country. This is how is living with depression on the person level or the community level. So let's see some numbers about depression worldwide. Based on the WHO reporting, they said that it's around 280 million people around the world has depression. And depression, the number of people who has depression, it increased from 59% from 119 to 2019. And it's expected that in 2030, depression will be the first cause of burden of disease. And it's known to be affecting women more than men. So these are just some statistics about depression. And depression has been significant disease for a very long time, and it's not getting better so far. And we can see it from the numbers here. So let's understand why is depression problematic, why it's significant for a long time, since like really long years. So there are a couple of three things. First, depression is not well understood. And why it's not well understood? Because it's a complex and heterogeneous disease. Depression can be caused because of genetic causes. It can be caused because of psychological and social causes. It can be caused because of some biological cause like inflammation. So it really has different causes. And it's manifested or can be presented in different ways. So this is first. So we don't understand depression well. And that's why it's not well diagnosed. Diagnosis of depression is usually based on the subjective testing, like the psychiatrist or the psychologist, he sits with the patient, and based on some symptoms, he tries to diagnose the patient. So it may differ from one psychologist or psychiatrist to another. So that's why it's based on subjective testing, not like other diseases like stomach disease or whatever that is based on clinical diagnosis. And finally, it's not well treated. And this is because it's a chronic disease and recurrent. So many people who has depression, they have it for very long years. And even when they are treated, it can come back again. So this is why depression is problematic. It's not well understood, it's not well diagnosed, and it's not well treated. And there have been lots of efforts trying to deal with these problems of depression. And I'm coming today to present one solution, which is, as I said before, it's called transdisciplinary solution. So what I mean by this, it's about incorporating biological, psychological, and social factors using computational methods and machine learning for studying and better understanding depression. So one issue with depression, as I said, it's complex and heterogeneous, and we have been trying to deal with depression as separate islands. Like a biologist will deal with depression with the biology of the brain, for example. Some person with genetic background, he will try to understand the genetics of depression, and a psychologist will try to understand the psychological and behavioral factors of depression. So this solution, it calls for incorporating all these factors together to try to understand depression in a holistic manner. And what is the effect that this solution can have on the path of treating depression? So first, it will help us in understanding the pathophysiology of the disease in a holistic manner, as I said. So we will try to understand what changes on the brain when a social evidence or social circumstances happen in the patient's life. And based on this understanding, we will try to enhance the diagnosis and the prognosis of the disease. So we will try to have a more personalized way of diagnosis that is more objective and more clinical. And finally, we will try to enhance the prediction of treatment response, because the treatment of depression, it's really big time. Sometimes it's based trial and error. So we try to, and patients, when they get treated, sometimes they lose hope in the middle. So that's what we are trying to do with this solution, to enhance the prediction of treatment response. So if I want to summarize what this transdisciplinary approach is doing, it's advancing our understanding of depression using a computational holistic approach with a hope to enhance our knowledge about such a complex disorders. And our main hope is to save lives, more lives worldwide. Thank you so much.
Thank you very much, Dr. Mai. You addressed very important and topic. Nowadays, suicide among children, young people, become an issue in many countries. And if we look at the causes of suicide, depression is one of main cause. And it's very well noted that depression is not well understood. And it's very well also concluded that depression is not just a psychiatric treatment. This requires multidisciplinary approach. And this is critically important. If we understand this and take it necessary timely measures, you can imagine we can save many deaths, I mean, globally, which is one of the severe complication of depression. But there are also other effects. Thank you very much. It was really nice. And also Dr. Mai provided evidence from research and from global statistics, which was really enriching what she concluded. Now I would like to give a floor to Dr. Nivin Dos, health specialist from UNICEF Egypt. She will talk about resilience of mental health. Dr. Navin, you have 10 minutes. Thank you so much.
Hello, dears. Good afternoon. Building on what we already heard from colleagues regarding schools and also regarding the extreme of depression, I will be starting with you regarding what we already know, because for UNICEF, we are focusing more on children. So we are trying to start with their needs and expectation to make sure that we are really fulfilling this and responding, not waiting for them until they reach school or even reaching the depression. So we are seeing what the information that we have, what the statistics that we are reflecting, how much we are spending on their health issues, how much we are suffering at the global level from their needs at this area, especially on the mental health and their psychosocial support that we can support, and also with the limited access, because we will never be waiting for them until they reach this advanced degree of depression, and especially if they are in the school. So how far we can really provide all the support that we can have, especially that also with the poverty and all the resilience needs that we are have currently, how we can be really willing to do it, considering that also for the climate change, it's an also need to make sure that we are overcoming this. Having some of the statistics related to Egypt is actually reflected in the number of cases that we are talking about and how far it is really struggling in their community to have this depression, to have among the mental illness age group, to have it reaching around 20% of this age group until being 19 and 18 as children. They are suffering from this. So we need to consider it as a priority in our services later that. Considering the available services and the people working in this area is not reaching even 1,000 physicians or even community workers. That's why we are relying to continue supporting in different entities, not only relying on physicians to provide it, but community workers, teachers, and all that social applications that we can have to provide the messages as much as we can. So the gap that we have, not only in Egypt, but also globally, starting from the COVID response and the real needs that we discovered, maybe even before the COVID response, because having it, because whatever happening worldwide for the climate change, because of the wars and the what's happening at different countries, and also then with the infection happening. So having this resilience is considering all the needs from the psychosocial and the mental health that they need to overcome. They are responding in this way, and we need to really manage it in the best way, not waiting for them until they reach depression. That's why we are working together to see what the causes and how far we can really integrate it in the best way. I don't want to wait for them, but considering and studying it according to research, this is very limited resources. That's why when we are saying that this resilience, it measures the looking for the significant response, it's really in deep need to have more research and more studies to be done, and also to apply the mental health and resolutions that we have applicable in this country. That's why I will try to be honest, not repeating any of the what we already heard, but actually to to make it applicable, to see how far we can use the different resources, not waiting for the final stage of depression, but finding a way to overcome this in the best way. That's why when we thought how to reach this target population as children until age of 18 and 19. But also you will find other target population considered. So don't feel like we are biased to children. But because we are also focusing on children, we are considering the services that they have, having the messages conveyed to them, having the peer support and coordination that we can do, not relying only on a service provider to provide it, but also on how kids they can use it in the best way, and also to reduce all the bullying and abuse and the criticism and the violence and all the challenges facing children in this age group in different countries, and how we can really rely on this in outreaching the children and really feeling they are satisfied and not suffering anymore. That's why when we are talking about children, nowadays we are not relying mainly on the verbal and the messages that we used to have, but relying also on advocacy and the community mobilization and having the online, not relying only on the physical seminars. That's why the services, I think globally, now having not only the hotlines that we felt like it's a creation to have it, but also having all the resources that we can convey the messages to them, even through them sitting next to each other, using it as a sports that they can do, or even sharing the service provider in the sports they are doing. This will convey the messages, not only relying on having a big camp like a camp, but also conveying the messages in a friendly way on daily basis, not waiting for them until they have advanced problem or sickness or depression to prepare for them their rights. For us to have integrated services, we are not providing the medical and health services, but also considering the child rights to overcome the violence that's happening, to exceed that high rate of mortality because of the mental statistics that we not really updating and relying sometimes on the use of tobacco or use of addiction or violence or whatever that is not really measured because of, for example, the emergency response, because of actually not reporting on it in the proper way. So having the different way from the children, from this age group, reporting on it at different ways to overcome and reach also the child rights, this is the critical area that we are trying to put it into action. Of course, having parents and having family members as part of the really providing a friendly way of relationship at the family level and at parent level, having parental contribution in the messages that we have, conducting training to parents and to family members, to cousins, to whoever is getting in contact together, knowing what's happening inside the home and conveying the message, how to manage it, how to overcome the challenges, how to listen, how to build a good relation with their children and neighbors and family members, cousins. This is a very critical area that we are relying on in the coming period. And we started it as part of parental engagement in whatever we are doing, having it as part of the service provision in primary health care, in hospitals, in youth centers, and even in schools. We are having some of the camps to engage parents with their kids in the same activities, whether it's sports or even it's a kind of innovation in whatever they are doing, to be part of what we are doing, engaging them in close discussion and see how they can build more understanding of their children. Having, of course, the service provider, like Dr. Ali saying regarding teachers inside the schools, but also engaging family doctors in the primary health care, nurses inside the primary health care units, but also the social provider and service provider inside the youth centers, inside the community leaders, religious leaders, to make sure that they convey also these messages in between themselves, and also reaching the adolescents and the kids, and also talking to parents, because those are the community service providers that will be really having more trust and more communication with parents and family members once they ask about any support. Having it also as part of the social services that they receive it, we reached even to have a good movie and good series that is happening throughout Ramadan most of the times and repeated all over the year. That is also conveying how messages is really making a big difference in our children life. So I think we are overcoming the challenges because of the resilience that we are going through and because of the mental issues, psychosocial support that people are expecting, especially in this age group that we are usually ignoring until they complaining from something really serious and coming to healthcare services to ask for help, but overcoming it from the daily life, from the other service provider, from the community outreach, and even from the social media that they are so friendly using in a best way to make a kind of proper awareness and service provision, and then referral to the real medical services when it's indicated. That's why I think kids worldwide will need our support in the best way, and will make sure to make the best of our resources available. Thank you.
Thank you very much, Dr. Naveen. Indeed, as adults, we have, this experience came by age, by practice. We have a resilient mechanism. But children, they are vulnerable to any stress, and they don't have such kind of resilience. They don't know what to do. They don't know where to go. In this aspect, it is critically important, as Dr. Naveen mentioned, we build the capacity of partners, caregivers, communities, services should be available, and try to bring issue to understand children's point of view. And this is critically important in order to have children to develop in a friendly and atmosphere without stress and without any, because it will affect definitely on their development and school progress and in their future life. Then I will come to our next presenter, which is Mrs. Shreya Tiwari, Associate Project Officer, Digital Pedagogy, UNESCO, Mahatma Gandhi Institute of Peace and Sustainable Development, India. Welcome. You have 10 minutes. Thank you so much.
Hello and a namaste from India. For those of you who were part of the session that we did yesterday, some of it may feel like a repetition, especially on who we are, but the rest is fresh, I assure you. Okay, I think to start with, the most important thing that my presentation will focus on is on ensuring well-being and trying to understand what that really means. It's not just the absence of mental health issues, but then what does well-being mean? At UNESCO MGIEP, we do a lot of work on mainstreaming social emotional learning. This is a phrase that Dr. Ali also in his presentation has talked about. I'm also grateful that he's presented the course that MGIP has developed on social emotional learning. But to give you a very quick snapshot, MGIP's vision is to build kinder brains, which essentially is a neuroscience driven vision, because brain is like a muscle which is trainable. How that works is something we're going to experience very soon. So at the Institute, our mandate is to promote SDG 4.7, and we do that by focusing and building peace education and mainstreaming social emotional learning. So we've heard a lot about mental health, and we've also learned that there is the spectrum that exists. But I do want to build your focus on the bottom side of this pyramid. which is the tier 1. Social emotional learning is for everybody. This does not just mean children, this does not just mean teachers, but it includes you and me, even sitting today. It's for everybody. There are some sections as you move on, there are smaller and more refined interventions needed. And then further mental health issues that develop is like the tier 3. So think of it like a pyramid. But SEL is more preventative in nature. And that's what MGIP is trying to focus on and mainstream in curriculums across the world. All right, so what is this social emotional learning? We've heard the term, we've heard the competencies that Dr. Ali's presentation talk about. I want to do a quick experiment with you today. And I invite you all to show me your fists. I mean it. Show me your fists. Okay. What we are going to do now, take the next 15 to 20 seconds and stay with me. Okay? You can put the fist down. Stay with the fist and bring your awareness to within you, to inside of you. Not children for now, not teachers for now, not health practitioners or doctors for now, but you, the person that you are. Okay? I'm going to read out a few sentences. And if you feel that sentence resonates with you, it's something that you feel, open up a finger. Okay? And remember, out of the 10 sentences, your score could be a 9, it could be a 7, it could be a 2, and it's fine. It's important to take this next 30 seconds to just reflect. Okay? So I invite you, be ready with your fist and with your fingers. You can pull it down, sir. It's a private reflection exercise, and I will ask you to project your fist at the end. Okay. Open your finger if talking to unfamiliar people makes you feel awkward or anxious. Open a finger if you are unable to sometimes control your anger. Open a finger if you frequently cannot name the emotion that you are feeling. Open a finger if you don't know what to do to feel better or to calm down when you're feeling anxious or sad or angry. And remember, I'm doing this with you, so we are in this together, okay? Open a finger if you were never taught how to manage your emotions in school. Open a finger if you find it difficult to support or comfort someone who's going through a tough time. Open a finger if you find it difficult to communicate assertively. Open a finger if you're scared of conflicts and confrontations with family member, colleagues, or friends. And finally, open a finger where you sometimes don't feel aware of your own strengths or of areas of improvement. Let's flash our wrists. Thank you. Just take a moment and look around. Just look around the room. And this is social emotional learning. And that's what we mean. It's something that you need, I need, everybody needs. All the competencies, all the 10 statements I read out are competencies of social emotional learning. And that's what we try to do at UNESCO MGIEP. Very quickly, does social emotional learning mean? Very broadly, it's defined as the process of gaining the competencies, skills, and knowledge both to recognize and manage your emotions, to take care of others and develop concern for others, and establish a positive relationship not just with ourselves, but also with others, with the environment that we are living in, and take responsible decisions when you face a challenging situation. Like Dr. Ali has already said, we are a twist on the Einstein's EMC square, and EMCC are the four competencies of social emotional learning. The ones that the 10 statements you experienced just now are all based on these four core competencies. Like I said, very quickly, I'm going to go through this on how brain needs to be treated like a muscle. What does that really mean? It's important to understand that neuroscience, and a lot of our work is driven by neuroscience evidence, is to recognize that learning is both a rational and an emotional process. So think back to a classroom situation where you were a child and remember that feeling when you didn't like a teacher or you were feeling scared of the teacher. Were you able to learn in that moment? You were not. Thank you for nodding. That helps. And that's what I mean, right? Remember when a child is scared or a child is just not in a mood? You don't get the child to learn in that moment. We don't learn in that moment. If you were sitting here hungry, perhaps you are, but this wouldn't be the best way to learn anything new, right? And that's what we mean. The brain is interconnected. The thinking and the feeling brains are interconnected, and that influences learning. So it's important for any learning to happen for us to train the social or the emotional side of our brain. And that's what we mean when we say that neuroplasticity, treating your brain like a muscle. So you train it using certain tools and practices that help you feel more in charge of yourself and bring you back into a pleasant state. So next time you hear a 60-year-old learning to ride a bike, remember they're training their mental muscle. Very, very quickly, we've already spoken about the benefits of SEL. This is nothing new for the group, I believe, but very quickly, it helps teachers and students both. It creates safer environments. And remember, it is also related to academic scores. So next time you remind yourself when you're in a situation and a child feels unsafe, the child won't be learning and it will affect their academic performance. At MGIP, we focus on the fact that teachers need to be equally SEL competent to be able to develop SEL capabilities in children. You can't pour from an empty cup, right? And that's what we believe. That's why a lot of the programs that we offer have a range of audiences. We work, the ones in the yellow are for the children. The ones that you see in the light pink on that side are for youth. The programs we offer for teachers are in red, which are social emotional learning and digital pedagogy, something I spoke about yesterday. All the courses we offer, ranging from climate change, biodiversity, global citizenship, all the courses at the core are linked to the four social emotional competencies of EMC Square. So UNESCO MGIEP offers free courses for all of you to go on and explore. They're not time bound, they're self paced, and they're digital in nature. So feel free to go and explore. That's my last slide. In the Middle East, and Dr. Ali's already spoken about it, the course for social emotional learning for teachers is already on the PAT and will be launched soon. We also work with UNRWA in the Middle East with the UNRWA and the field offices on the digital pedagogy course and social emotional learning. On that note, those are my details. Please feel free to reach out if you have any questions or you want to look up what MGIP does or even take our courses. Thank you very much.
Thank, thank you very much, Shreya. And was actually very excellent conclusion of this, concluding with tips, guidance, providing reference to free resources which can build up a capacity how effectively to manage stress. We are living in an environment every day we are facing with stress, and those tips are really, really helpful. We have actually 2 minutes only. If there are any burning question, please. Yes, there is one question very quickly. Do we have a mic? Colleagues? Yes, mic is coming. So please try to be short because we have only 1 minute now.
My question is directed to Dr. Ali and Dr. Nivia and Dr. Shuri about can we, as a youth, benefit from Gandhi institution experience in Egypt here? And another part in my question directed to Dr. Niveen and Dr. Mai Gamal. What is the right thing we can do with the person who is suffering from depression? Thank you.
Thank you very much. Actually, let's start with Professor Ali. Try to be brief.
شكرا جزيلا. الحقيقه يعني خير الكلام، انا عن نفسي استفدت من تجربه معهد غاندي لان لهم منصه رقميه رائعه ثريه جدا بالفيديوهات التعليميه بالمحتوى العلمي في مجال التعلم الاجتماعي الوجداني، فهي ثقافه انسانيه جامعه كلنا نتعلم بعضنا البعض، فبالفعل نستطيع ان نتعلم ونتبادل خبراتنا بشكل جيد ورائع، لان هم قطعوا شوطا طويلا ونحن لا نحتاج لبدايه الطريق بل نكمل على هذا الطريق ان شاء الله. شكرا جزيلا على السؤال الرائع. شكرا.
Nevin, just 30 seconds.
Okay. زي sorry. It's exactly like what Mai mentioned regarding depression. We have two main areas that some of them are really genetic areas that will be happening in the family. So not waiting until this to happen, by having all that outreach, orientation, well-being and psychosocial support from the family, from community, from care service, and from whoever has accessibility to this opportunity. And the other point is where we don't have any feedback or any family background, so we can keep tracking how we can really avoid reaching to that depression. Because yeah, some sort of kind of avoiding stigma, this is one point. And the other point, reaching the good message that it's avoidable and we can reach not to suffer from it. Once we keep that channel for communication open between everyone might be stressed or having very difficult situation, and how to overcome and offer some sort of resolution and solutions in their life to make sure that they can find a way out of this stress. Thank you.
Thank you very much. So our time is over, and thank you very much for your attention, and dear thanks to our speakers. You have a chance after session ask your question to the speakers. Thank you so much.
السادة الحضور الكرام، شكرا لحسن استماعكم. سنبدأ الآن استراحة قصيرة، وسنعود في تمام الساعة 3:15 لمناقشة المزيد من المواضيع الهامة. We will now take a break. Please take this time to refresh and engage with fellow attendees. We will be back at 15:15 to discuss the intersection of income inequality and social protection. Thank you. السادة الحضور